This is Clergy TV.
Hello, our viewers. This is Ask Your Doctor on Clergy TV, and I'm your host, Murugi Muturi. And today with me, I have Dr. Geoffrey Magada as we look at breast cancer. We have looked at cancer in general. We have looked at cervical cancer, prostate cancer, and now we are looking at breast cancer. Karibu sana, Daktari.
Thank you.
It's always a pleasure to have you on the show.
Thank you for having me.
Welcome. So, Daktari, what is breast cancer?
As we have defined cancer before, cancer is abnormal proliferation of body cells or abnormal growth of body cells. So breast cancer here means abnormal growth of cells in the breast, in which case now you have cancer cells in the breast. And we saw earlier that these abnormal cells do not die like what would happen in a normal situation, and that they grow on to spread to other areas in the body. And this is so true for the cancer of the breast.
All right. So, seeing that these are cells that will grow abnormally and enlarge and spread to other parts of the body. So, which are the signs and symptoms that you should look for so that you know you have breast cancer?
The major signs and symptoms are a lump in the breast. That is usually the earliest sign. If one has a lump in the breast, it is always good to have it checked. We need to know that not all breast lumps are cancerous, but the only way of knowing whether a breast lump is cancerous or not is having it checked. So breast lumps, but later on you may get nipple discharge in breast cancer. You may get pain in the breast. You may also get ulceration, forming of a wound around the breast. But pain, wound formation, nipple discharge, these are presentations that occur late. Usually the earliest is a breast lump. And that's why we emphasize that women should do self-breast examination, and you can also do healthcare provider breast examination, so that if these breast lumps are done earlier, are checked earlier and found earlier, and if these breast lumps are then diagnosed and cancer is diagnosed, then it is quickly treated, and the chances of cure are higher. But if the breast cancer is diagnosed late, chances of cure are minimal. And so it is important to intervene, to get the screening and get the diagnosis early, and so that an intervention is done early to improve the chances of cure. Now, there are certain risk factors that are associated with breast cancer. Smoking is one of them. A family history of breast cancer. If somebody in the family has had breast cancer, you are at higher risk of having breast cancer. Even colon cancer, there seems to be an association between the two. If somebody has had colon cancer in the family, then somebody in the family is likely to have breast cancer. We need to know that breast cancer tends to occur more in women. So women are at a higher risk of developing breast cancer. Those are the commonest risk factors. Obesity is another risk factor for breast cancer. Having fewer children or having first child at an advanced age is also a risk factor for breast cancer.
Wow, that is interesting. And just to ask, how does having a child, later in life affect?
These are things that have been associations.
Yeah.
It has been shown that women who have no children or very few children are at higher risk of breast cancer, or women who have children after 30 years are at a higher risk of developing breast cancer. Yes, I can see the interest it has generated in you.
It is very interesting.
Yes, but indeed, those are associated risk factors, but then no one really knows the exact thing that would be leading to that. But probably breastfeeding has a protective effect. No one knows. Yes.
Okay, that is very interesting. And so we will. Is it right to say that there is no particular age at which you can say this? You are more likely to be affected by breast cancer. Maybe older women.
Age is a factor, but not as much as it is in other cancers. Okay. But it is a factor. Okay. As you grow older, but you must have those other factors that I have mentioned. A family history of breast cancer or colon cancer, a smoker, obesity, nulliparity, meaning having less children, or having a first child at an advanced age. Yeah, those are the other factors that could be associated. Now, if you have multiple of such factors, then your risk is higher.
If you are a bit older now.
Yes.
All right. That is interesting. So when it comes to breast cancer, we have come to places, so that is in now treatment and the diagnosis. You talked about it being
the diagnosis of breast cancer. As I said, the breast lump is one of the presenting symptoms. So that breast lump must be subjected to the laboratory through a biopsy. So usually we will take a tissue, either through a fine needle or through an excision, a removal of the breast lump. Then that is taken to the laboratory, and then that will give us a diagnostic proof as to whether it is cancerous or non-cancerous. Those are the main diagnostic procedures, but as part of the screening procedure, we have what we call a mammogram, which also helps in screening for breast cancer. Mammography is sort of like a special X-ray that will then show the breast tissue and will show where the cancer is. So as part of screening, because we said in the early stages of breast cancer there is no symptom other than probably just a breast lump. So the best would be a screening process where there is self-breast examination, which has to be done regularly. There is healthcare provider assisted breast examination, which again has to be done regularly. Then there is a mammogram, which has to be done every 5 years. All right, and then those are part of the screening procedures. And now when there is a breast lump, it has to be biopsied, either through fine needle or excision, for proof of whether it's cancerous or not. And once cancerous, then now there are available treatment options. And the treatment options, just like we talked about we've talked about in other cancers before, the treatment options are surgical, depending on how far it has gone, radiation and chemotherapy. And you can do all of them based on how advanced the cancer is. If you get it earlier, then the treatment options are fewer. It's just surgery and probably radiation. But now when it is found late, then there has to be chemotherapy. Sometimes chemotherapy is given before surgery. Sometimes radiation is done before surgery so as to reduce the tumor load. So all those options are available, and the healthcare providers will be able to assist anyone on the way forward in such situations.
Thank you, Sana. Daktari, we are going to take a short break and then come back and we can ask a few questions.
Thank you.
Thank you so much, our viewers. This is Ask Your Doctor on Clergy TV, and we are talking about breast cancer. Please remember to like, subscribe, and share across all our social media platforms. Also remember to download our app on Clergy TV on Google Play Store. Thank you, and please continue watching.